This is where we all sit down and share a cigarette. Not really, but we're finding more and more South Africans are sharing cigarettes, believe it or not, even though, what the minister told us is that, we can't share, right? Okay, but let's get to the details. The University of Cape Town, or UCT's research unit on the economics of excisable products, or REEP, recently conducted an online survey of the behaviour of smokers under lockdown. So the survey found that the number of smokers sharing cigarettes increased from 1.7% to 8.9% since the start of the restrictions. Researchers added that the government's intended reasons for the ban were apparently related to concerns regarding the detrimental health effects of smoking, as well as the desire for people not to share cigarettes. But this has been ineffective. The survey also showed that prices of cigarettes in the black market have increased up to, listen to this, 250% since the ban was implemented in March. The study was conducted over 2 weeks in June with 23,000 respondents participating, and Professor Corné van Walbeek, the director of the research unit on the economics of excisable products, or REEP at UCT, who conducted the survey, is our guest. Goodness me, I mean, these numbers are unbelievable. Thanks for joining us. Welcome to the program.
Good morning, Leanne. Thank you.
So the survey, it's an absolute pleasure. So the survey basically showing that more smokers are sharing cigarettes amid the pandemic than before this lockdown. Did individuals explain why? I think I know the answer, but why are they doing this?
Yes, if I can make a small correction. So before the lockdown, 18% of smokers indicated that they were sharing cigarettes. After the lockdown, that 18% increased to 26%. The numbers that you are quoting is the number of people that share cigarettes so regularly that they are sharing at least half of their cigarettes with someone else. And that number increased from just less than 2% to about 9% during the lockdown. And the main reason for that is because cigarettes have become so incredibly expensive. As you quite rightly indicate, the cigarette prices have increased by 250% during the lockdown period, in some areas by substantially more than that even, and in some areas, specifically in Gauteng, Mpumalanga and Limpopo, by somewhat less. But the increases have nevertheless been very, very dramatic.
This is thank you very much for correcting us. We obviously had a bit of confusion there, but I mean that I think is a much more accurate picture, because it would, I imagine, be a lot more people sharing. It's expensive. You can't afford to buy them. I mean, people are buying loose cigarettes for, I don't even know. I'm not a smoker, so I don't know what people are buying cigarettes for. But I mean, I've been hearing some astronomical prices. What are some of the prices that you've been hearing for boxes, for loose cigarettes? What's going on?
Yeah, so for the average price of all cigarettes in the sample of respondents that we looked at, the average price per cigarette was about R5.70. That equates to a per pack price of R114 per pack of 20 cigarettes. Some of our respondents have indicated that they paid as much as R300 for a pack of 20 and up to R3,000 for a carton of 200 cigarettes. So those are really, really astronomical prices that have never been seen in this country in the past.
That is just, I mean, this is almost defeating the whole object, because obviously these cigarettes you're talking to are reputable brands that we know. We don't even know, or perhaps your study did include, what's going on the illicit market, because as we've heard and it's been explained to us, the illicit market is flourishing at this time.
Well, to be honest, everything right now is illicit by virtue of the fact that cigarettes are not supposed to be sold at all. So we see that all companies have been making lots of money during this time period. What was particularly interesting in our study is that the traditional brands, the brands produced by the multinationals like British American Tobacco, Philip Morris and Japan Tobacco International, those brands have decreased from a pre-lockdown market share of about 75% of the market to less than 20% of the market. The shares of the so-called local companies, these are the companies that are typically associated with the Fair Trade Independent Tobacco Association. Their share has gone up from about 20% pre-lockdown to something like 70 to 80% during the lockdown period. So we see a major disruption of the market where especially the local brands have taken over the market very, very substantially in this very, very peculiar situation right now.
These are interesting figures. They really, really are. And hence, all of these court cases that are taking place because of the shift in buying patterns and how it's now working. But, obviously, the cigarettes you're referring to, these ones, the international brands that are coming through, the locally produced brands, but the illegal brands, the ones that, even when it is legal to smoke in the country, are still illegal to purchase. How are they doing?
So, what was interesting for us was that within the space of these 3 months, the top 10 brands pre-lockdown have fallen out from the top 10 during lockdown brands. And we see that a number of brands that before the lockdown were reputed to be illegal, they were not paying the full tax on their cigarettes. Many of those brands have tripled, quadrupled, and even multiplied their market share by 5 times during this lockdown period. And we see that those brands have really come to the fore. These are brands that typically would have been regarded as being on the fringes, as being discount brands, as being illicit brands before the time. Now they have become very, very dominant in the market.
I mean, this is research. This is evidence in itself that people are finding alternatives, that banning cigarettes and the sale and production of any tobacco-related product is not working. From what I'm reading into that, from just what you've said, what did you read into it? I mean, is it working or not?
I think it's fair to say, and we make that point in our report as well, that the intention of the ban was to support public health, and it was well intended. However, when the ban was extended as we moved from lockdown 5 to lockdown level 4, I think that was a good time to reallow the sale of cigarettes simply because the ban was not working. People were already at that point in time purchasing cigarettes on the illicit market. South Africa has got a very significant illicit trade problem even before the lockdown. Before the lockdown, the illicit trade was anything between 25 and 35% of the market. It's very substantial. And now at the moment, it's of course 100%. And we believe that yes, the intention was there, but the application of this particular lockdown has been very negative. I want to just emphasize that the research that we do is pro-public health. We are not for the tobacco industry. The tobacco industry rather dislikes us, but I suspect that this kind of research is not helpful from a or rather, can I rephrase that? The research that we did has shown that the intervention that the minister has done by banning the sale of cigarettes has not particularly.
I completely understand what you're saying. It's not advocating anything to do with smoking and smoking's good for you or anything like that. It's purely research that you have conducted to show what has changed in the tobacco industry with regard to the buying and the selling of cigarettes and the consumption and thereof. But there's also the monetary value that's placed to all of this. And the findings that you've said show that for every month that the ban is in effect, government loses 1 billion rand in revenue. Perhaps you can talk us through that.
Yes, so the excise tax on cigarettes in normal circumstances is 17.40 rand per pack of cigarettes. The Minister of Finance earlier this year indicated that he aims to receive about 14 billion rands worth of cigarettes during the current financial year. So you can do the math. The math is that just over 1 billion rand of excise taxes would have been gained in normal circumstances. That money is now lost. Yes, 1 billion rand in the bigger scheme of things is not a lot of money from a government perspective, because if you just think about it, the coronavirus emergency budget is something in the order of 500 billion rand for this year. But all that money adds up. And what's happening now is that money ends up in the pockets of the tobacco industry. They might actually be getting more than that amount of money into their pockets simply because the prices are so much higher than what they were pre-lockdown. And we think that that is going to result in very significant detrimental long-term consequences.
Yeah, certainly. Job losses, the likes. We're losing revenue from every angle right now. And unfortunately, we need to get that money in to the coffers, which it's not happening. Instead, this money, and as we talk about this, the black market trade flourishing flourishing right now. We know all the cigarettes are illicit cigarettes at this time, but that black market trade is growing bigger and bigger and faster, and they're making more and more money. What you've also said in all of this is that if this carries on, the banning of the cigarettes, it's almost going to become impossible to root out this black market. Why? Why do you say that?
So we are very nervous about that the long-term consequences of the current ban is going to be specifically detrimental in years to come. What we see is major disruption, as I've indicated, where the previously large companies have lost major market share, where the small companies are now the big companies, and both of those have got an incentive to reduce prices the moment that the ban is lifted. The international companies want to gain back their market share. The small companies that are now big companies want to maintain their market share. And the best way to do that is to reduce the prices of cigarettes. And we're going to find that people might have started enjoying these new brands that they have been purchasing over the lockdown. Previously, they were only used to multinational brands. Now they are forced to buy local brands, and they say, well, I'm getting used to it now. The price is not bad. At some point in time, after the lockdown is over, they will still stay with those brands, and that's going to then create the incentive for the multinationals to try and capture the market back. And the best way to do that is by decreasing the price of cigarettes. What we are proposing strongly in our study is that the government should significantly increase the excise tax the moment that the ban is lifted. And the reason for that is if the companies are going to go onto a price war and reduce their prices, the best way for the government to maintain those prices is to increase their share of it. And by increasing their share of the price, you do it by increasing the excise tax. Of course, associated with that is that the revenue services should have very significant powers to be able to curb the illicit market, even though it is to a large extent becoming more and more entrenched in the economy. It's basically a very, very difficult conundrum in which we are finding ourselves right now.
Yeah. Prof, I'm going to ask you this straight out. Do you think government should lift the ban?
Yes.
It's just not, the benefits from what I'm hearing are not what they originally started out to be a health benefit, because right now what you're explaining to us is that they're having much more detrimental effects. And people, here's a question for you as well. Has anybody given up smoking? I mean, out of all of the people that were surveyed, and the fact that they can't buy their regular brand, the brand that they used to smoke, have they given up, or have they just moved on to another brand and gone on to these other cigarettes that, may not be familiar, but they are now the top best-selling cigarettes of the country?
Yes, Leanne, that's a very good question. So we asked that question of our smokers, and we try to get an understanding, why do people quit? If they have quit, what numbers have quit? So we just want to emphasize the fact that our sample is not necessarily nationally representative. It was an online sample. For that reason, the people at the lower ends of the socioeconomic spectrum, because they haven't got computers and so on, typically would not respond. So within the context of our sample, 9% of respondents indicated that they had quit smoking. That 9%, 57% of those 9% that quit smoking indicated that the price was the major reason for them wanting to quit. Another 14% of quitters or wanting to quit smokers indicated that they were unable to find cigarettes, and only 11% of our respondents indicated that they quit because of the sales ban and because of the regulations that were associated with the lockdown. So what we are seeing is that the economic imperatives tend to have a very significant impact on people's decisions to continue smoking or to cut back on their smoking.
Yeah.
And for that reason, we make a strong case for increasing the excise tax the moment that the sales ban is being lifted.
Yeah. Two quick questions, and I suppose, just to ask you, vaping, because a lot of people are also concerned about the vaping issue. Was this included in this at all? I didn't read that part of it, but was that included?
No, we didn't ask people about vaping, but what we do know anecdotally is that people who are vapers found it more difficult to find their products, and what was and anecdotally, the scary part is that many of them then moved back to smoking normal cigarettes, which, of course, is not something that one would want. One would want people to not vape, not smoke, but you also don't want to have the substitution effect between the two.
Professor, final question to you. There's been a lot of calls for the proper scientific evidence that government has been given that smoking will make the situation worse or be detrimental to anybody. I mean, from what you've seen that has been supplied to us as South Africans in terms of the documentation, the scientific evidence, or anything as a matter of fact, are you satisfied with why government are carrying on with this and saying that, it's a health thing? Because it right now sounds like something bigger than a health thing.
So as an economist, I feel qualified to talk about economic matters. I read the public health literature and I see that there's a lot of noise in terms of the different publications. One saying that smoking actually has got some preventative characteristics, although nobody's actually telling please smoke because it helps you to protect against the virus. We're not at that point over there. But the public health evidence seems to be quite mixed. At the same time, the fact that South Africa is the only country in the world right now, there were a number of other countries previously who also had a sales ban on smoking, specifically Botswana and India. But South Africa right now is the only country in the world that has got a ban on the sale of cigarettes. That, to my mind, suggests that there is something, let's call it, different about South Africa, and where different forces are coming into play that are not just related to health or economics or anything else. I think that there is a deeper political aspect that is happening over here, but I'm afraid I'm not in a position to talk about that because I don't have that kind of knowledge.
And we respect that, but thank you for talking to us. Really interesting findings from this research that's been done. Professor Corné van Walbeek, who is the director of the research unit on the Economics of Excisable Products at UCT, talking to us about the survey they conducted that found that amid the pandemic, people are sharing cigarettes more than before the lockdown, and a whole bunch of other issues as well as price increases and everything else. I mean, in fact, while we're conducting the interview, Nonoza gets hold of us and says, my neighbors are having coffee over a ciggy. They are actually sharing one cigarette. They live in different units and they are getting together to have coffee and share a cigarette over the wall. All right, there you go.